very good morning to you and welcome to NTV Today. I'm your host, Smriti Vidyarthi. This is the show that brings you everything you need to know from across the country. We run from 9 o'clock all the way right through to 1:30 p.m. During this broadcast, we will bring you live links from various locations, plus an update from the world of business, sports and entertainment as well. Later this morning, we will be focusing on the topic that is cancer. Remember that just yesterday, the world marked World Cancer Day. So we'll delve deeper into that topic, especially taking into account that the nurses are on strike today. So really, how does that affect all those in hospital and all those seeking treatment? There is, of course, a link between the two. Also, we will be crossing over live to NTV's Kevin Mutai in Mombasa and also Melita Oletenges in Nyeri. Melita will contribute to the conversation about cancer, and Kevin Mutai will bring us an update from the city that is Mombasa. So let's kick off with Kevin. What do you have for us? What's happening at the coast this Tuesday morning?
Good morning, Smriti, and we are glad to join the broadcast from our bureau here in Mombasa. And just among the stories that we have on our diary today here is that 25 people have been injured after a bus driver lost control in Maisenyi, that is between Maungu and Taro. We're told that the bus was heading to Mombasa from Nairobi, where it got involved in an accident. We're told that the driver lost control in what police believe that it could have been caused by the heavy downpour that was currently ongoing at around 4 a.m. in that particular region. We're told that the bus belongs to Tamid Bus Company and the registration number is KCC 201H. We're told that those who were injured have been ferried to various hospitals. Among them is Moi Referral Hospital in Voi. Also, another story we are following up on is the bond application for the 3 suspects involved in the fatal shooting of the former Kilifi ex-deputy governor Kenneth Kamto. The 3 suspects, including Julius Gitonga, Joseph Amwanyi, Mukabana and Florence Mwanza, they will be in court today to hear on their bond application. The prosecution argues that the 3 should be denied bond on grounds that they still portray according to their previous criminal records, they are dangerous, and that the prosecution believes that they might influence the ongoing investigations by tampering with witnesses. We also have the National Assembly Committee on Agriculture, which is retreating here in Mombasa to discuss the new Potato Act. We believe that in what will transpire from that discussion will, of course, be to protect the potato farmer from exploitation, and we will be covering that for you. We also have the reclamation of Kibarani. Now, visitors entering the coastal city of Mombasa will be treated to a new refreshing site at Kibarani dump site. Remember, this has been an ongoing process, and that the project, which is still ongoing. Remember, recently the county government, together with officials from the United Nations, visited the site in efforts to try and reclaim the region. But as at yesterday, wildlife sculptures and artificial grass carpets were installed in that area, and this has elicited mixed reactions from members of the public, those who are traveling also in Mombasa. Just to read a few tweets to you from some of the people who are concerned about that particular issue. From Mohammed Ersi says, and I quote, "What would a reindeer that is not even indigenous to Africa, let alone Mombasa, be doing at Kibarani? Please, Mombasa County, simplicity is key in life. You started very well. Dump site closed, trees planted, and you watered them, growing really well. Turf and sculptures is a no." We also have Makzende saying that Kibarani was stinking filth, but Mombasa Cement has changed all that. This is something that we'll be covering, and of course checking out on the developing updates from that particular story. And not also forgetting, Smriti, the ongoing national strike in the country. Remember, the strike is not happening here in Mombasa, and Mombasa is among the coastal counties, including Kilifi and Kwale, whereby nurses are going on with their daily duties. But pay deductions, the issue of staffing, and also they want promotions. These are some of the cases that they have threatened the county governments that they is needed to look into those issues before they also participate in the industrial action. Smriti, those are just a few of the stories that we are following up from the coastal city of Mombasa, and we will be covering that for our viewers in our subsequent bulletins during the day. Back to you, Smriti.
Right, Kevin Mutai bringing us the very latest from Mombasa. Thanks very much indeed, and of course more from you later in this broadcast. Lois Wangoi joins us now. She comes to us live from the county of Uasin Gishu. Good morning, Lois. What do you have for us?
Many thanks, Smriti. From the county of Uasin Gishu, will be starting the day by joining into the conversation of cancer. Granted that this particular disease has now become quite rampant, and gone are the days when cancer was a disease for the affluent only in society. So immediately after this, I will be heading to the streets of Eldoret to speak to the residents and to understand, or rather to get their views and thoughts on their understanding of cancer. What has been their experiences? Have they had to have a loved one just go through the disease, or have they had to have a loved one managing the disease, or what do they even know about cancer, and how are they maintaining healthy lifestyles to ensure that they keep cancer at bay? So that will be the point of starting our diary here in the county of Uasin Gishu, by understanding how the county understands or rather manages cancer that has become a disease that has become quite rampant. Just to also mention other items that we'll be looking into from this part of the country. One is the issue of the nurses' strike. Now, even as it happens in phases with the 11 counties that are set to start the strike. First, we understand that the neighboring county of Elgeyo Marakwet is among those particular counties, and later in the day I will be traveling to E10 and its environs to just take a look at the picture of what is going on in public health facilities during this particular day, where we understand that nurses in that particular county will be downing their tools, and of problem that will present with that of Uasin Gishu. It will also be interesting to take a look at the national cereals and produce boards doors now that the president and the minister for or rather the cabinet secretary for agriculture had ordered for NCPB to open its doors and to start purchasing maize from farmers. That particular purchase has not yet begun, and we were able to see last week just queues of many farmers lining up and trying to take their crop to the NCPB for purchase. So is NCPB already opening its doors and doing that particular purchase? That is also something that will be of interest to us, Smriti, and we'll have that in our subsequent bulletin, of course, in the business desk. But for our earlier bulletins, our main focus on this particular day will be the nurses' strike, as I mentioned, with a sharp focus on Elgeyo Marakwet. And immediately after roping into this cancer conversation, then we'll be able to bring you pictures or the perspective from the county of Elgeyo Marakwet, and to just understand how the nurses in that particular county are carrying the day. Have they reported to work? Are all of them just going on strike, or are some being left at public health facilities to attend to the patients? That is something great interest to us, and we'll just be checking on that. In the meantime, immediately after these, first things first, we walk into the streets of Eldoret, talk to Wananchi on the ground, and understand what do they understand about cancer. Have they had to go through that experience, maybe through themselves or even a loved one, and how are they managing? And another question that we would like to ask them, do they feel like the government or even society as large is putting up all the efforts needed in fighting cancer and helping those living with cancer manage the disease? For now, back to you in Nairobi, Smriti. Smriti.
Lois Wangoi, thanks very much. Of course, plenty coming to us from the county of Uasin Gishu. We look forward to hearing from you and also all those that you speak to on the streets of Eldoret to get a sense of what they know about cancer and really what they think needs to be done to improve the situation, if at all. Okay, from Uasin Gishu, let's now take you to Nyeri. Here is NTV's Melita Oletenges. Good morning, Melita. What do you have for us today?
Good morning, Smriti. We are coming to you from the Nyeri County Referral Hospital, joining the conversation on cancer on a day that also the nurses are expected to down their tools and go on strike. The county government of Nyeri yesterday, however, released a statement saying that they have the needs of the demands of the nurses catered for, and therefore they should reconsider going on strike. But Smriti, we are just going to join the conversation on cancer, a disease that has really robbed so many people of their loved ones, a disease that continues to cause a menace in the society. And Smriti, here in Nyeri particularly, this is a region that is known for high prevalence of non-communicable diseases that includes cancer and diabetes. And we just want to delve into this matter further, and I'm going to be joined by Dr. Saringi Dorin. Thank you so much, Daktari, for joining us. First of all, what is a common type of cancer here in Nyeri?
So the commonest types of cancers depends on the gender. So in women we have breast cancer and cervical cancer. In men we have prostate cancer and cancer of the esophagus, but generally the GI tract. Yes.
And Daktari, the prevalence of cancer has robbed so many people, and what has emerged as one of the many reasons that people are losing their lives to this disease is because of the treatment. Probably, how do you treat patients when they come here?
So generally treatment of any cancer depends on the stage at which the patient presents. So for early disease there is surgery. That is the first line treatment for early disease that hasn't metastasized or gone to other organs. Then we have chemotherapy for late disease and radiotherapy. So generally treatment is 3 types: surgery, chemotherapy and radiotherapy.
And another question, probably when patients come here and they start receiving treatment, you as doctors, do you sometimes give them the hopes that they are going to maybe survive the disease? And how do you deal with the stigma that they face?
So about hope, as a doctor, you need to tell the patient the truth. If it's a disease that carries a bad prognosis, there's no need to give a patient hope that is not real. So depends on the stage, really. And we try to do our best. We try to give the best that we can, but we don't overpromise. Just treat the disease, inform them about all that they can do to just prolong life, or if it's treatable, we also try to do that. Yes.
And you've said that the treatment of cancer depends on what stage the cancer is. And there are some stages that we are told that this patient can no longer live. Probably as a doctor, where you stand, you have a palliative care for patients. Tell us, how do you take care of them in the palliative?
They've been sent to us from various hospitals, various departments. So they come with a diagnosis. We do other tests to stage, like say this cancer is this stage, then we decide the modality of treatment. If it's cancer that can be operated on, it's early cancer, we send them to the surgeons for operation. Then after that we'll follow up and maybe offer chemotherapy, radiotherapy. Unfortunately there's no radiotherapy in Nyeri, but we send our patients to KNH. Then there are those patients who need palliation. The cancer has gone so far, so the only thing that you can do is actually try to prevent their pain, give them blood, make sure they go to the pass stool, such things. So palliation, giving chemotherapy and referring when necessary.
And the other thing is the screening. So many people don't go to get checked for cancer from time to time and regularly. Probably as a doctor, what do you recommend for patients or any other person who, in terms of getting screened for cancer?
So the most types of cancers, as we've said, in women, there is breast cancer and cervical cancer. So screening for breast cancer, we normally advise those women who are at risk, and those are women who have relatives who've had cancer. Like if as a woman, my mother had cancer, or my auntie or my sisters, then we tell them we are at a high risk. So because of this, you're supposed to, if you're below 35 years old, you need to do a breast ultrasound, and above 35 years old, the screening modality is a mammogram. But then there's also this, we normally tell patients to do self-breast examination, although it's not very reliable. So these days we are telling patients to at least go to a doctor and have a full body examination once in a year. So this full body examination will have a doctor examining your breasts, yes, and picking up any lumps early. And yeah, then send them to the necessary referrals, yeah, when possible. Then for cervical cancer is one of the most preventive. It's one of the cancers that can be prevented because apart from screening, we have vaccines. So our country is not doing vaccines, but we are telling people that you can take your young daughters, age 9 to 13, for vaccines. We have Gardasil and Cervarix vaccines. They are available. So you only need to, not in most public hospitals, but most private hospitals have them. Then pap smears. Yeah, below 21 years old, you don't need a pap smear, but at the age of 21 and beyond, you need to do a pap smear like every 3 years. And then from the age of 30 to 65, a pap smear every 5 years. And then for men, prostate cancer. Above the age of 35, you need to have your prostate checked. You need to do prostatic-specific antigens. Yes.
Thank you so much, Daktari, for shedding light on the cancer screening and methods that can be used here for treatment. But Smriti, I am going to speak to a cancer survivor now, and if you can just join me here, just start with your name, tell us your name, and tell us how did you first discover that you had cancer, and how was your journey to survival?
My name is Nyeri Elizabeth, a breast cancer survivor of 10 years. When I discovered that I had a cancer, it wasn't the normal way. I had gone for the normal screening when they come for free checkup, and they had educated us on checking on our breast. And I have been biblically doing it. But one morning I noted that there was a change in on my breast, which was not normal. I waited for at least a day, and the following day there was still the change. So it wasn't, I hadn't put either the lotion properly or anything, but I went to see a friend of mine who is a nurse, and she told me, yes, there's a problem. But no, she didn't tell me what type of a problem, because even if you have some rashes or you can have those mashiringis, you won't know. So she told me that I should see a doctor. And I even didn't think that I could have cancer in that way, because most of the time we thought cancer was a lump, it was a big wound, it was something that you can't explain. But here I had brains had changed color, and I wasn't having any pain. So I went to another doctor who I tried to ask what to do, but unfortunately they didn't have they didn't give me anything, but they were telling me to do something to do with FNI. But when I inquired from another doctor, I was told to go for a mammogram and ultrasound. But all those ones, you go to the first mammogram and you're told there's something, you don't believe it. You go to the second and even the third doctor, until I left Nyeri and went to Nairobi. And when I went to Nairobi, I went to like 3 doctors differently, because, you don't believe that you have cancer. You don't. You just don't tell the doctor, yes, I have. Because cancer in our community is a death sentence. Cancer wanasema ni kurogwa. It's like a curse. So how do you admit that you have it? So after going to many doctors and many tests, I went to one doctor in Nairobi who really told me that according to all the results, I had breast cancer. Unfortunately, the way he did it was the worst thing, because He didn't even cancel me. He just told me, you have cancer and it is confirmed and we are going to chop your breast. To a lay person or to a mwananchi, a person who have, uko tu huku mashinani, it was something that I couldn't handle. And I left that hospital and tried to get somewhere else. Fortunately, after some time, I got a doctor who counseled me. They counseled me. They have a team. They worked with the doctor, the nurses, the oncology nurses, the social workers, the counselor. And as a team, they counseled me and they told me my cancer was at a very early stage and they'll move my breast. But after some time looking at the results and their results, they told me they'll remove a big part of my breast. And luckily enough, the cancer had not gone far. It was in early stage 1.
And how have you been able to deal with the stigma, having in mind that now you're coming back to the community, probably people know that you have cancer? How are you able to deal with that?
That was the most bad thing that really happened to me, was the stigma. But first is the family. My partner left when I was at the hospital, so I was alone and fighting alone. And when my friends and the community came to know that I had been operated, I was going through cancer treatment, that was the time that things really were bad, because the stigma was so much that I even went into some kind of depression, because everybody was pointing at you. I had my business in Nyeri town, so most of the people know me. So when you find somebody pointing at you, it's not the best. Next, the breast is you don't have part of your breast, so one breast is smaller than the other one. I hadn't mastered what to put there, how to do it, how to shape myself, and it was bad, because when a friend tells a friend that you're going to die within 3 months, that was very bad. When the family start now thinking, like in my home, I'd lost my parents, I had lost my brothers, and my relatives were now going full blast into acquiring our parents' property. Just because I had cancer, they weren't considering that I have my children. Luckily, the ones who did the counseling for me was Nyeri Hospice, and they had a program of legal aspects in palliative. And I had learned that we had the new constitution, and as a woman, I had the right. So I even fought for my parents' property, not to be taken by somebody else, but they weren't considering that. So it was a hard time. The stigma was worse than the disease, because it was the death sentence. But fortunately, I came out of it. I'm lucky the Nyeri Hospice, they trained us with legal aspects in palliative. They trained us with taking care of being a caregiver, being a frontier, and I started frontiering in Nyeri Hospice, and even here at the PGH at our palliative unit. And with other women, we came out and we started coming and talking to the community. We've been educating our community for long. We have a group, Slopes Cancer Awareness Networking, which goes to churches, in barazas, in chief's praises, in the mosque, and we teach prosthesis and give them. Last year, in October 25, we celebrated the World Cancer Awareness Month, and we had all the survivors from Nyeri, Muranga, Kirinyaga, Nanyuki, and even other places. And we give them free prosthesis, we give them free breast forms, sleeves, wigs, and others, even counseling them, even telling them that cancer is not a death sentence. Cancer ni ugonjwa kama ingine.
Thank you so much for sharing your story with us, Madam Nyeri. And you've just heard it from her that she's saying that the stigma is worse than the disease itself. And she's saying that she discovered she had cancer in a way that she herself wouldn't think that this is the way cancer looks like when you're diagnosed with cancer. And you've heard her story, a very touching story there, Smriti. And that is what are some of the stories that are here in Nyeri from cancer survivors such as Nyeri here. And one of the issues issues also that she's been able to mention, that it boils down to the family level. And she says when people learn that you have cancer, family, friends tend to distance themselves from you, and these are some of the challenges that they are facing as cancer survivors. Now she's a cancer survivor, but then she was a cancer patient, and she has braved this particular disease and won the fight. Smriti, we are also keeping tabs on what is happening here at the Nyeri County Referral Hospital, and from what we've been able to observe is that activities are going on as usual, and nurses here are expected to down their tools, but we are not sure if truly they are going to down their tools, because the county government of Nyeri, as I said earlier, released a statement yesterday telling the nurses that they have their needs catered for, and they are going to ensure that the budget that the nurses are demanding for is catered for in the treasury. And Smriti, this is what we are trying to follow up on, but we will be informing you what is happening in this part of the country. Smriti.
Melita, thanks very much, coming to us live from Nyeri, having spoken to a doctor there on the issue of cancer and also a survivor. What an inspiring story. And here in studio, I have my guests as well. We will delve deeper into the topic. But first, let's just bring you some facts and figures as we look at cancer in context. Now, coming up on your screen, take this in. Back in 2018, there were 47,887 cases of cancer reported here in Kenya. Now, in 2017, the disease claimed 16,953 lives. That's a rise by at least 5% every year. The main causes are people's lifestyles, which include excessive alcohol consumption, high-fat diets, and indulging in smoking. There are, of course, plenty of other reasons. Some of them include environmental causes, such as hazardous workplaces and pollution, and some also genetics as well. Now, have a look. These are some of the most common cancers. They are lung, liver, colorectal, stomach, and breast cancer as well. And look at some of the challenges. They include funding and expertise. Now, with regard to funding, the government sought to address this through a total of 7.4 billion shillings allocation to cancer cases and also equipment. Further, the country has very few oncologists who, in essence, are in fact cancer specialists. Well, how can you help yourself? Exercise is something you can do, and also managing your weight. Do not indulge in excess smoking and drinking, and also eat a diet rich in fruit and vegetables. Of course, also spread awareness, as that key information also does help. And the infographics on your screen has been sourced from the Nation Newsplex. All right, so some key statistics there that really bring home the seriousness of cancer. Now, Makueni Governor Kibutha Kibwana, with the backing of the Kwanza Member of Parliament Ferdinand Wanyoni, want the government to declare cancer a national disaster. He spoke during the burial of Machakos Catholic Bishop Norman Wambua's father, who succumbed to prostate cancer. And the leaders decried that many Kenyans are suffering with the high cost of treatment. The Kenya Medical Research Institute documents that 80% of reported cases in the country are diagnosed at an advanced stage, leaving few options for remedy.
Nafikiri tumefanya mpango tayari, tunapeleka hoja bungeni ili mambo ya kansa iwe national disaster. Wewe na mimi tuende for testing early enough, ili siche ikawa stage nyingine, it becomes very difficult to reverse.
Afya kwa ujumla ni jambo la county, lakini tunaona kwamba linahitaji national government tushughulikie sisi sote pamoja. Serikali itenge pesa maalum like a cancer fund, ndio watu wale wanakuwa ni wagonjwa wanatibiwa.
Well, the plight of children living with cancer also comes to the fore as we recognize World Cancer Day. At Kenyatta Hospital, nurses had dedicated their time and work as foster parents of these children. But they, of course, have to grapple with the challenges of children who have been abandoned at the oncology ward at the Kenyatta National Hospital. Eunice Somola reports on the life at the children's cancer ward at KNH.
It is a few minutes after the lunchtime visiting hours at the oncology ward in Kenyatta National Hospital. An art and craft session is ongoing. These young ones are creating beauty out of life that is anything but rosy. These buildings are second home, a school, and a sanctuary for better health for about 28 children living with cancer.
So these children are left with us as young as 4 years. So it is us as the nurses who take care of them. We provide for them whatever they need, and we feed them. We take care of what they need when they are here in the hospital. We have about
a number of them are referrals from various centers. At KNH, they receive chemotherapy, radiotherapy, and other types of treatment. Parents are only allowed to visit the children who are under the care of 18 nurses running activities at the ward for only 30 minutes. The unit has been home to Stephen Kipkelion's son for close to 2 years now. When he first bought the child, he was against leaving behind his 4-year-old son under the care of the nurses. His son suffers from neuroblastoma cancer stage 4, a cancer that arises from immature nerve cells in infants and young children.
Sasa kuadmit mtoto hapa, nilikuwa nafikiria tutalala na mtoto. Nikaambiwa mtoto alikuwa ni wa miaka 4. Nikaambiwa mtoto atalala, wewe uende nyumbani. Sasa nikashangaa mtoto anawezaje wa miaka 4 ambaye tumezunguka na yeye analala karibu na mimi akae katika Kenyatta Hospital peke yake. Nafikiri sister akaniambia, daktari wa hapa akaniambia kwamba sisi tuko na ujuzi. Hata kama ni mtoto ni mdogo.
Sadly, some do not get to get the visiting times with their parents, especially those in the last stage of the disease.
Some parents abandon their children here, mainly because the stigma of this disease. And when they hear the children have cancer, they just switch off. And they leave the children knowing that they will just be told your child is dead. They kind of fear, they don't want to be associated with what is happening. They won't. They abandon them because of the financial challenges that they go through. They go through a lot of challenges. Some are from very far. You see this is a referral center. So if a mother is referred from Eldoret or from Lodwar, if they come, Garissa, coming back to see their children becomes a challenge. And so you can find the children staying here for a long time without somebody coming to see them.
For their stay to be comfortable, the nurses at the oncology unit pull their resources together to ensure that they get love just as those who are visited. They are provided with essential requirements like soap and even fruits. The burden of cancer weighs heavily on some of the parents with children at the ward. Charity Waithaka brought her son to the unit in January 2018 when he was seriously unwell after a diagnosis of leukemia in 2017. Her journey to ensure her son got proper treatment has been one too costly.
Then they try to get the insurance, and from there, the insurance can sort them out. But still, there are others who can't even afford to get an insurance for NHIF insurance, and the bill becomes a burden. Others, you see, they are burdened; they have no one to take care of that. And so the hospital at long last will have to.
Other challenges include lack of specialized treatment for some of the children who, for instance, need bone marrow transplant. Most of them do not get treatment, leading to progression that finally becomes fatal.
The NHIF can upgrade their services to help these children. we can have very good outcomes. Like now you find they only give very little to those who are going out. The rest of the money they are supposed to food, and they are not able.
The hospital strives to ensure that the children at the hospital are well taken care of and live a normal childhood life by also offering education for the children in their stay at the facility. Eunice Omolo, NTV, Nairobi.
Well, some of the statistics show that cancer is indeed one of the key leading causes of deaths in Kenya, and it's threatening to move further up the list of top killers in the coming decade. Research published by the Nation Newsplex review of health data shows that the rate of death from cancer in Kenya is far outpacing population growth and may double in the next 11 years. Speaking at the Don Bosco Church during the Requiem Mass in honor of Bessie Maureen Yaya Mutuku, NASA leader Raila Odinga was accompanied by his wife Ida Odinga, and had said that the country keeps shooting itself in the foot when it comes to the war against cancer.
God, we must up our game as people of Kenya. Every year, some of the best students after school certificate do medicine. We produce doctors in this country. What is it that makes us always try to take our people outside for treatment? I think sometimes our priorities are upside down, are not clear.
What I think was referring to is creating facilities for early diagnosis of diseases like cancer, so that you can diagnose cancer when it is still manageable. This is a problem we have in this country. You're being treated for ulcer, and for a lot of time they will give you medicine supposedly for ulcer, because they have never taken you to be properly diagnosed, tested properly. By the time they're discovering that it is cancer, it is too late.
Now, a saw from a train crash 29 years ago is now threatening the life and well-being of a man from Trans Nzoia County. Gabriel Korinyang lost his legs in 1989 after being run over by a train while relaxing at his home. Now, despite his resilience, his life is now threatened by the ravages of cancer.
Ever since that fateful day in 1989, when a train ran over Gabriel Korinyang, he has been using prosthetic limbs for his day-to-day engagements. His brother, Jackson Emuria, however, says that starting 2016, a sore formed on his right limb. This, he says, has been informed by Korinyang's growing body, which could not anymore be accommodated by the prosthetic.
Sasa juzi hiyo mguu alikuwa anatembelea aliwekewa zamani sana, ambapo hiyo mguu sasa hizi vile amekuwa mtu mzima ikawa ndogo. Sasa hii plastic ikawa inamfinya hapo ndani. Sasa ikapata kidonda kidogo, ikaanzia hapo. Nilipofika mwezi wa 11 nikaona kidonda inazidi sana. Nikaambia daktari, hii mguu imezidi. Akaniambia wacha tupeleke kwa theater, wakakata nyama kidogo. Tukatuma na Nairobi iende ikapimwa. Kupimwa ikapatikana results kurudi, ikapatikana hiyo mguu imeingiwa na kansa.
Korinyang, who has been relying on making bangles and earrings for his upkeep, has been transferred to the Moi Teaching and Referral Hospital, but the family lacks funds to meet the medical bill. His neighbor, Margaret Juma, says Korinyang has exhausted his savings, which he had been helped to accrue by a missionary from the United States.
Kabla hajakuja hapa walikuwa wameanzishia hiyo kazi ya kushona shanga, losari, bangles hizo. Na walikuwa akishona nyingi, sasa anachukua anapeleka commissions wanamuuzia. Na hiyo pesa sister alikuwa anamwekea, akimwekea. Sasa wakati walienda wakamwachia kwa akaunti yake. Na katika hali ya kuhitaji hiyo akaunti alitumia hiyo pesa ikaisha.
Family and friends of Korinyang are now calling on well-wishers to support them in seeking the required medical attention. Julians Amboko, NTV.
All right, well, that story by Julians Amboko brings us to the focus now of our conversation this morning, and it is about cancer. Remember that just yesterday the world marked World Cancer Day, and with me now in studio, my guests join me. From my extreme left is Shienze Kasoha. She is a cancer survivor, and Shienze, we heard your story last night on our 9 p.m. news, a true inspiring story, and we'll hear more from you. Beside her is Dr. Sarah Muma. She is a pediatric oncologist, that is a doctor that specializes in cancer. Beside her is Philip, and Philip, you are a patient support manager at the Faraja Cancer Support Trust, and beside Philip is Virginia. Virginia, you lost your mother to cancer 10 years ago. All right, karibu to all of you, and thank you so much for joining us as we discuss this very critical but also sensitive topic. And Shienze, I'll begin with you because, of course, the world marked Cancer Day yesterday. As a survivor, what did the day signify to you?
First, I didn't know it was World Cancer Day. I just woke up to Facebook.
Okay.
And everyone is like, oh, you're a fight. Everyone, my inbox was spammed with World Cancer posters. And I'm like, okay, so we have a day. So I reflected back of many people I've lost through cancer, and the challenges they have gone through. And along the way, when I was doing my cancer treatment, I joined a support group. And many people that I thought would finish the race, in the middle, they ended up passing away. Like, I lost about 8 people. So in my mind, I was like, wow. So I think this is supposed to be their day and celebration. And yeah, so it really brought a lot of memories. And the day I received my results, the pain, the journey. So the first part of the day when I woke up and just saw messages, I spent a lot of, it was a sad day for me in the morning. But in the afternoon, I picked up and said, oh, let me just enjoy the day. Yes.
All right, well, that's a positive outlook to it. And for those who don't know, what sort of cancer did you have?
I had ovarian cancer.
Ovarian cancer.
Yes.
How long ago?
I've had treatment for 9 months. I finished my treatment in end January, so let's say an year. Last year, February, at such a time like this.
All right, and you completed your treatment just recently then.
Yes, yes.
So
yes.
good on you.
Thank you.
Virginia, for you, of course, you lost your mum to cancer 10 years ago. What sort of cancer did she have, and what did World Cancer Day mean to someone like you?
For a start, my mom had breast cancer, and then just before she was cleared, it had moved to her lungs. So it was a combination of both, and it was at stage 4. So there was very little we could do about that. I think for me, what it means is I'm able to identify with a lot of people, especially caregivers, who are taking care of loved ones with cancer, and my heart goes out to them in a very big way. Just listening to the lady in Nyeri and the stigma that follows with it, and the financial burden as well, and the emotional aspects of also being a caregiver, really my heart goes out to them. And seeing, you know, Shienze just smiling is really a testament that you can have the disease, but at least your spirit is still, your spirit is still alive. Because I remember Mom was always happy. You'd have to be, to think twice. Are you really sick? Okay, until you see her throwing up. So my heart really just goes out to anyone who's dealing with it, and especially people who have a loved one or are taking care of a loved one. Yeah.
All right, well, Philip Odio, I'll bring you in at this point because you are one of those people who is in charge of other people taking care of cancer patients and also survivors. You are the patient support manager at the Faraja Cancer Support Trust. Tell us more about your role really and the impact that Faraja and yourself has on cancer patients.
Thank you, Smriti. I work as a patient support manager, but I'm a clinical psycho-oncologist, so basically helping cancer patients and caregivers understand the emotional burden that they go through during treatment. And Faraja has been there for 9 years, And as you know, it was started by a cancer survivor who noted that there was not much support that the family members were giving. And it's not because they didn't want to, but sometimes they didn't know how to give that support. So when Faraja was started, we've been there for those 9 years offering support for the cancer patients and the caregivers. I think the focus has always been on the patient, but not the caregiver. So I identify with her, having worked with many patients who come to the center to be able to get the support that we give through complementary therapies. And one of the things that we do at Faraja is we are trying to also expand, because the need is really enormous. You know, when you're diagnosed with cancer, you're dealing with diagnosis, it's something that is new, you're dealing with stigma, you're dealing with family members. So it's a lot of things to go through, and of course the treatment. So we are there to work with the patients by offering, you know, counseling services, by offering nutritional advices and lifestyle change advices.
Okay, and Dr. Sarah Muma, from your perspective as a pediatric oncologist, where are we today in the battle against cancer? We earlier had a look at some figures. In 2018, a staggering 47,887 cancer cases were reported here in Kenya. We're not doing very well, are we?
No, we are not, but we are trying to make progress. I would say, especially speaking for the children as a pediatric oncologist, that of those 40,000+, about 3,000 of those are children. And you find that many people believe that children cannot get cancer. So it's a very shocking diagnosis to families, to relatives. But 50 years ago, cancer was, in children was a death sentence, even in high-income countries. So to see that there's progress now, you can talk about surviving cancer for children, much as our survival rates may not be as high as those in the high-income countries, but we are trying to make progress. I can say that the government has also put strategies in place. There's the National Cancer Control Strategy that was rolled out in 2017, the second strategy, which this time includes a lot of matters concerning children. So there is progress, but we're still very far from where we could be.
Shienze, from your experience, what was it like dealing with cancer from, of course, the emotional perspective, but also the financial burden and the perspective of access to healthcare?
Yeah. First, as I told you guys yesterday night, if you've listened, when I got to realize I had cancer, it was a bad state, because I was trying to get, why am I sick for this long and I'm not getting a solution? So in fact, for me, my insurance had exhausted. I had taken a loan, for lack of a better word, from someone and told them I'll return to you in a week, because after a week I'll know what is ailing me and I'll be back to my business. So I took a loan, I got some tests, then the money was over. Then I had to take another loan to get to know what is the final, like I was referred to another hospital for clearer diagnosis. So when I went and I found the results, and I was like, wow, so am I going to pay the loan or start my treatment? So it was a shock for me, and my immediate family were depending on me. I was the breadwinner of my family. They were depending on me. And my mom also was just a recovering patient. So I was like, do I do this or I don't do it? It was such a confusing phase. And then when I checked online, because you see, in a digital age, you'll check online. And even through my journey, I've tried to even record things that are encouraging to other cancer patients, because when you check online, you only see death, but you don't see any positive thing. So I was like, what is the benefit of me going through the whole journey and then at the end of the race I die? That is wasting people's time and energy. If I'm going to die now, why can't they just inject me or something? And I went actually to the oncologist and told the oncologist, if you know I'm going to do this treatment to the end and I die, stop. Don't start the treatment. It's like, no, you need counseling and stuff. No, I don't need counseling. I'm sober. I will go for counseling myself. I just want to know that if I'm going through the whole treatment, I'm going to survive. It's not like I'm going through the whole treatment and then what next? So I went through counseling first for about 3 weeks, and then I hid it from my friends. So I handled it, I managed it alone for about 4 months. But then now, since I had pressure from the people who gave me the loan, they don't want to hear about cancer. People who have cancer have talked about it, you know? And then I had pressure from provision because my insurance I had exceeded the limit. Unless maybe I'm admitted. I couldn't be admitted because I was taking care of my family. So I decided just to share with few of my friends. One of my friends took it over and supported me for a whole month. But then now, his finances also got depleted. Right. So we had to now reach out to the public. We created a poster and we tried to share out to the public. And I could get support and here and there we had a pay bill. But now the challenging part of it is the pay bill was catering for the medical. If you look at it me being a breadwinner, going through the cancer journey, it means my family is still depending on me for rent, food, and everything. So even during the whole journey, there is no point in my life I can say I rested. I was still working and going through the treatment, which the doctors and the support people will tell you, it's really hard and it's really painful. But really, there was no option. The financials were hard. Even if people share it out, I think we are yet to come to a place of generously giving. People can have it, but they feel like, oh, this is just like another one. They're generously giving. If you don't have the finances, give someone food, right, pay their rent, something, give them accommodation. Because for me, it was a lonely journey, especially from October to December. I was like, I'm not gonna make through. Yes.
But you did.
Yes.
Philip, this is where partly Faraja comes in and why Faraja was born, as you said. How does the Trust offer support that's so desperately needed by patients such as Shienze?
Yeah, I think thank you for, you're a strong lady, very strong person, because she was going through treatment, but at the same time taking care of her family. And basically at Faraja, we have a fund, we have a trust fund that offers financial assistance for people like her who are going through treatment. So that's something that we offer. But besides that, I think it's really important to encourage cancer survivors, because I know the challenge is when you're diagnosed, you know, you're dealing with this alone. It's really important to identify someone or an institution that you can work with. I know the initial stages you're trying to figure out what is this disease, and sometimes due to lack of understanding, we don't know the treatment process. Right. And this is where sometimes I kind of like blame the doctors. Take someone through the expected treatment trajectory. So for example, you tell them, we are going to give you surgery if it's breast cancer. After the surgery, then there'll be probably chemotherapy, and then after chemotherapy, you might need radiation therapy, or you might need brachytherapy if it's cervical cancer. So when you take them through the trajectory, then financially, then they also begin to plan. But if you don't understand, you just think, okay, after surgery, I'll be done, and then now I'll be okay. And then you realize that you still have other treatment that are coming up. Right. So I think that's part of the education that we need to help the patients understand.
Sarah, I'll just bring in Sarah. What is your contribution on that point of the role that the oncologist and the doctor has to play? Because also earlier we saw the cancer survivor speaking to my colleague Melita Oletenges, saying that the way she was given the information and the way forward was very brutal and very difficult to handle.
Yes. Thank you. I totally agree that it is our responsibility as doctors in how we deliver the information. Much as we are, as the doctors, that we are seeing cancer every day, treating patients every day, it doesn't lessen the seriousness of the matter. And it would be good, it's actually required of us to spend time with one patient at a time and explain exactly what is happening, explain the diagnosis, explain the stage of the disease, the aspects of treatment. We know that we have some financial support from NHIF. it is not enough, but it has improved. And it's important to explain to a patient that this is how much NHIF may assist you with, and you may need to look for this much, and also adjust the treatment modalities to work with what the patient has. Because at times, even some of the tests that we request, you need to weigh, can we actually, are we delaying treatment by doing so many tests that the patient cannot afford? Or what can we do? Where can we meet in the middle? It really is important to tailor the whole conversation around every patient, because everyone is different, not to just have a random blanket statement. I would say that perhaps for doctors also, if one has not gone through training in terms of how to deliver this information, if you do not have a team supporting you, you may be overwhelmed with the work and forget the conversations. But having a support system, having maybe your palliative team assist you, a nurse who's there with you, so that the patient also feels like there are people who truly care. Right. So yes, it is our responsibility.
All right, and just before we take a break, Virginia, I'll bring you into the conversation. We've heard how Xianze tackled the news and the process. What was the case in terms of your family?
Well, for a start, my mother was not the breadwinner, and I applaud you. I mean, that is amazing, right? So for her, that was a plus in the sense that there was my dad coming in, but at the same time, it was still a big, a big burden to be able to go for the chemotherapy and the radiotherapy, and we're still in school. And also the special, your diet has to change at the same time. And then the side effects of the chemotherapy were also, quite difficult for her to do. What we had to do was rally around as a family. And granted, you will find the family members who don't understand, and the family members or even friends who will come in and, it's such a stigma. That was 10 years ago. We have support groups now, but back then I do not think, or rather maybe we also didn't know what to do with that. So we had to give the gift of just letting go of people who we thought would help, but didn't, and embrace those who allowed to come in. And it's quite interesting when we got to a place where we are saying, you know what, we've been hurt enough times, let go. We had angels. I keep calling them angels of mercy. I'm Christian, and I remember once a Muslim family walking in, and like, we've heard about your mother. We're like, okay. So, and then the lady goes off, we want to provide you with A, B, C, D. And then we had someone else who came in and said, for this period of time, I'll cater for your mom's food needs. It was one little miracle after another. At some point, we had to stop the chemotherapy. And I was working at a children's home at that time, more or less volunteering. And randomly, the owner asked me, how is your mother? And you develop an answer of fine, thank you, for those who really need to move on. Sure. And you develop, let's now move on to what you needed to say. Then he was like, no, I'm asking, how is she? I was like, she's okay, she's doing her chemo. And I'm like, even if I tell you, what are you going to do about it? So finally, he pressed on, and he asked me, how many more shots does she have to go? And the guy wrote out, he is the director of a children's home, you'd think the orphans need the money more. Sure. And I wrote out a check, and go get the treatment. So really, I agree with her, if we had more people coming around, and not just asking what I can do, just looking at the situation, just offer what you're able to. Sometimes it can be a listening ear, sometimes it can be in terms of finances, sometimes it could be in paying rent, but it really goes a long way in lessening the burden and wiping the tears of the family.
And no doubt it is a huge burden. The government has allocated 7 billion shillings to cancer-related issues in the budget, but the economic burden globally caused by cancer is 118 trillion shillings. So really, we'll delve deeper on the issue of finances and also expertise as well. Why don't we have enough oncologists in the country? There's plenty more to talk about here on NTV Today. We're taking a quick break, but don't go far. We'll be back in a moment. Welcome back to NTV Today with me, Smriti Vidyarthi, coming to you live from the Nation Centre. It is 10:15 this morning and our conversation on cancer continues with NTV's Martin Mwara. He joins us live from Murang'a. Martin, good to see you. What do you have for us today?
Good morning, Smith. As you have said, yes, it's a good morning from Murang'a County, County 021. Now, we're just going to delve on our topic for today, which is cancer. Now, as you have clearly said, cancer continues to be among the killer diseases in the country. And it is actually worse when it comes to the rural setup, where cases of late diagnosis, misdiagnosis, they are said to be on the increase. I just want to talk to a cancer survivor. Tell us maybe how she has been able to beat the disease from the rural setup. Karibu sana.
Thank you.
Okay, just maybe start by introducing yourself and tell me how you've been able to.
Okay, my name is Njoki Kamina. I'm a teacher by profession. I'm actually teachers in Murang'a North have elected me as their NAT Executive Secretary, Murang'a North Branch. I was diagnosed with breast cancer in December 2013. It has been a long journey and a very expensive journey. I didn't have an insurance scheme, so I despaired. I almost despaired, but with a lot of family support, I was able to go to hospital. We raised some funds through a Harambe, and I have been having treatment at Akan Hospital. Yeah.
No, sorry, continue.
Yeah, it has been very challenging. The process is very challenging. For myself, I went through surgery. I also went through chemo and radiotherapy, which are very, very expensive procedures for the common person. I paid about 1.5 million to be treated up to where I am.
Now, have you been able to maybe to beat this disease, and what challenges, apart from monetary, what are the challenges considering that we are in a rural setup? How is it able? Is it easy?
Thank you. For me, let me say I've been able to beat the disease. I'm a cancer survivor. I go yearly for reveal, and God is good. The doctors are telling me they cannot detect the cancer cells now. But for the rural setup where I am, actually I'm a chair lady of a support group where members are suffering very seriously. Economy is down in the rural setup. These are people who are very poor, and they cannot even manage treatment, leave alone any other thing. They are very desperate. We are trying to assist through well wishers, and it has been very, very difficult for them. I lead about 50 people in Murang'a County who are in the support group. Unfortunately, we have lost about 10. And poverty level is very, very serious on the ground. These people are unable to go for treatment at Kenyatta, Texas, and the other facilities because of lack of money. Nutrition is also a problem to them. Feeding procedures are not very good. They are not able to get a good diet, and the disease is devastating, and they get weaker by the day. Yeah.
Now, maybe you said that you have a support group. Maybe has the county government played any role to try and arrest the situation where cancer is said to be on the increase?
Let me say we are happy with the Murang'a County governor and the CEC Health. They are really supporting us. As we talk now, from January this year, we have an oncologist who is in the district hospital right now. So he's able to screen the people, and those who need procedures from other hospitals are referred to Kenyatta and the other places. They are also supporting us to get drugs. But let me say, drugs are not very much available. Our people are really suffering. They are suffering seriously. We need the government to come up with measures and strategies and declare this disease a disaster, just like HIV, where they can give drugs for free because these people are not able to buy drugs at all. It is very, very challenging. I'm telling you, the people are dying in the villages because personally we travel and see our people in the rural setups to see how they are doing and give them hope. there are very many challenges and they are not able to get treatment.
Okay. In terms of cancer is very expensive to treat, and people have NHIF. Do you think it's high time the government extends the amount that is given or paid through to the hospital during the cancer treatment?
Yeah, that is a good idea. I think the government should really come up and extend NHIF so that it really caters for the cancer people comfortably. Because as we talk now, NHIF is not really assisting us in a good way. And we would want the government to put more measures so that it is enhanced to support cancer patients.
Maybe one last, you are parting shots to cancer patients who are suffering from cancer as a survivor.
Thank you. I want to give hope to those people who are going through cancer treatment and urge the government to get more awareness, because when cancer is detected early, you get well and you are healed completely. Yeah, we want the government to put more measures on screening and awareness in all the villages all over Kenya. Thank you.
Thank you so much.
Thank you. God bless.
Thank you. Now, Smriti, as you have heard, yes, those are just some of the comments from a cancer survivor. He's saying it is possible to win the fight against cancer. Back to you, Smriti.
Martin Mara coming to us live from Murang'a. Thanks very much. And clearly the financial burden is a huge problem for so many people across the country. Before we took the break, I brought up the figure that 118 trillion shillings is the global economic burden of cancer when it comes to finances, and 7 billion shillings has been allocated to cancer-related issues here in the country in the current financial year. Well, let's find out what's happening from Nakuru County. Bridget Ngana joins us from there. Hi, Bridget. What do you have for us?
Well, Smriti, we are at the Nakuru Level 5 Hospital, and specifically in the oncology wing that was set up last year in this hospital to help cancer patients within the South Rift region to get treatment. Most of them used to come all the way to Nairobi to just get assistance. But I'm going to be joined on set by two cancer survivors on how this center has been able to help them access treatment and care vis-a-vis the cost that this disease has put on them in terms of family. I'll just start by this man here. Mzee, karibu sana kwenye NTV. Tuambie jina yako na uligundua uko na saratani mwaka gani na umekuwa ukipata matibabu hapa katika hospitali ya Nakuru Level 5 kwa muda gani?
Anaitwa Ibrahim Kimemia. Na niligonjeka last year Januari. Lakini kuenda kwa matibabu ugonjwa kupatikana mwezi wa 4. Tangu mwezi wa 4 kupatikana nikapelekwa Naivasha nikatolewa nyama kwa mdomo. Kutolewa nyama nikarudi hapa. Akaipima kaonekana ugonjwa wenyewe, sasa akaanza kunipea dawa. Amentiniti sasa nimemeza mpaka nimesikia mzuri. Sasa bado hapo ndio iko na shida kidogo tu. Sasa baada ya kuja kliniki ya mshora last month, last year, nilikuwa tarehe 3. Kasangata damu iko chini. Sasa ongeza kunipea dawa. Nikapeleka kwa ward kuongeza damu.
Tueleze jinsi hii imekusaidia, kwa sababu wewe ni mkazi wa Nakuru, imefanya hujaenda mpaka Nairobi, pengine kama Kenyatta ndio inajulikana ungekuwa ukipata ya matibabu kama haya. Umeridhishwa pengine na vile madaktari hapa katika hospitali ya kaunti ya Nakuru wanakusaidia kupambana na ugonjwa?
Amenidhika sana hapa iko sawa. Juu sasa tangu mimi nichukue niko sawa kabisa. Sipokuwa niyo problem nasikia tarehe 3 hiyo ndio ingekuwa nimeshapona, hata ingekuwa nimekuja huku. Kwa hivyo hapa iko sawa.
Tuambie kwa pengine kazi yako unafanya nini na imebidi pengine uache kazi, na matibabu haya yamegharamiwa na NHIF ama yamekugharimu pesa ngapi?
Mimi mwanzo hapo niligharimu pesa yangu kiasi, labda kama sichukua kadi ya NHIF. Sasa nimechukua kadi ya NHIF ndio nagharamia. Sasa mimi hapa sijui inagharimu pesa ngapi, hao ndio wanajua, lakini wananilipia kila kitu tangu last year mwezi wa 4. Sijatumia nduru yangu, hao ndio walipaga.
Ujumbe wako kwa Wakenya kuhusu ugonjwa wa saratani na jinsi pia tunaweza jisaidia kama nchi kugundua ugonjwa huu na pia kuitibu kwa wakati ambao unafaa?
Inafaa ikipatikana ugonjwa wenyewe kwa haraka inaponya. Lakini kama ukizubua kama hujaona daktari, ifike stage 3 4 iponage. Sasa kama umepata mapema utapona.
Yako ilikuwa stage gani?
Ilikuwa stage 2 lakini ilikuwa kukaribia 3. Daktari akaiona mapema. Wakatibiana naye kabisa. Yeah.
Asante sana. Also being joined on set by another cancer survivor. Her name is Elizabeth Maina. Just kusonga tu karibu. Na utatuambia majina yako. She tells me that she's had a double mastectomy. But tuambie tu, when did you discover about the lump on one of your breasts?
I'm Esther Maina. I discovered the lump 208. Then I went to Kenyatta Hospital. I was done surgery and 6 sessions of chemotherapy. Then I went 25 sessions of radiotherapy.
Yes.
Yeah.
Okay. Tell us maybe in the time that you were treated, how much was that straining you in terms of going to Nairobi and coming back for treatment compared to now here? You're telling us your second surgery, you've been able to have it here in Nakuru and you're still continuing with your treatment here.
Acha niseme ya kwamba kulikuwa na ugumu ni kwa sababu ya kutravel. Pia unajua Kenyatta watu wanakuanga wengi sana. Kwa hivyo ilibidi upange laini ndio upate matibabu.
Tuambie pengine kimapato ulikuwa unafanya kazi gani na pia vile ili kugharimu kujitibu hadi pengine sasa utatuambia hii operation yako ya pili umefanya kwa njia gani?
Mimi tu nilikuwa housewife farmer siku hizo. Mume wangu ndio alinisaidia.
Tuambie pengine kwa kina mama. Tunajua kuna ugonjwa huu ina affect kina mama. Ni nini ambayo inafanya ujue ama ugundue mapema ndo hata sasa iweze kuwa umepata treatment na unasemekana wewe ni survivor wa saratani?
Kina mama wanatakana waangaliange matiti zao kwa sababu ni kalampu kadogo ambako nilipata kwa titi langu kadogo tu kama mchele. Nilipofanya biopsy ikasemekana ni kansa. Ndio nilikimbia Kenyatta nikatibiwa.
Tuambie pengine wewe ni mama na unajua ukiwa mgonjwa pia nyumba inaumia. Tuambie ulikuwa unajipa moyo kwa njia gani kwa sababu wakati mwingi mtu akiambiwa kuna saratani anaona ni kama amepewa death sentence.
Nilipoambiwa niko na saratani nililia sana nikikumbuka ati ya kwamba saratani haiponi. Na pia siku hizo watoto wangu walikuwa wadogo. Walikuwa bado wengine wako primary, wengine wako secondary. Sasa unaona matibabu, kusomesha watoto ilikuwa ni ngumu. Hata ilibidi nifanye harambee siku hizo, sikuwa na NHIF, tukafanya harambee ndio ilinisaidia nikaenda Kenyatta nikatibiwa. Kwa hivyo ninahimiza wakina mama ya kwamba hata mtu yoyote anaposikia kitu yenye si mwili wake si wa kawaida anakimbia hospitali ili ajulikane mapema ili apate matibabu aendelee kuishi.
Tueleze kuhusu operation yako yenye umefanya hii mwaka. Ulikujua tena kuna uvimbe kwenye titi lako moja. Ulifanya nini vile uliona na vile ulikuja hapa? Ulihudumiwa kwa muda gani na kama umeridhishwa?
Sasa 208 March ndio nilipata node kwa armpit. 2018. Nilipopata node kwa armpit, sasa si nikakimbia hospitali. Nilienda Kenyatta kama mara 6. Nilipoenda Kenyatta kama mara 6, nilitumwa picha nyingi sana, biopsy, CT scan, hizo zote na ultrasound. Sasa zote nikakuja nikapiga. Nilipopiga nikarudisha huko. Kurudisha huko wakasema nitaenda clinic tena. Sasa nilipogundua ya kwamba hapa pana clinic, sasa mimi nilikuja na picha zangu, nilifanya photocopy picha zangu, nikakuja hapa, nikawaletea na wanaendelea kunitibu vizuri. Ni kwa sababu saa hizi nilipata 6 sessions of chemotherapy, nilimaliza October 29, alafu sasa nikafanya surgery on 18th January. Ndio nilifanya surgery. Sasa ndio nimekuja niangaliwe vile kinonda inaendelea. Lakini niko sawa. Pia na meza hizi dawa za miaka 5. Zinaitwa Letrozole. Naendelea kuzimeza.
Na imegharimiwa na NHIF ama familia yako?
Kuna saa zingine inagharimiwa na NHIF kama dawa ziko tunapatiwa. Kama hakuna itabidi uende ununue nje.
Asante sana. Thank you so much. Na tunaomba upone na asante sana. I'm also going to be joined on set by the doctor in charge of this oncology unit here at the Nakuru Level 5 Hospital, Dr. Dalcy Wanda. She is the one who's been administering treatment to the patients who've been presenting themselves here. Dr. Wanda, thank you so much for joining us on NTV Live. Just tell us, how old is this center? And so far, how many people have you been able to treat since this center was opened?
So the center was opened May 24th. It was opened by His Excellency the Governor, Lee Kinyanjui. He's the one who officiated the opening of this place. It was opened in collaboration with the Ministry of Health. We've been able to administer or to review 5,613 patients. That's from May to January, end of January, we've been able to give 150 IV chemotherapy drugs, and around 12 patients are on oral chemotherapy drugs. So those are the patients we've been able to serve here. However, there's a huge number of patients who come. Our catchment area is quite large, considering the centers that have been well known since time immemorial have been Kenyatta and MTRH. So that has meant we've had a huge catchment area, many patients coming from very far areas to come receive services here, even counties that are very, very far. We have patients who are coming from central province, counties that are in central part of the country. We have others coming from Narok, we have others. So it's really a cosmopolitan center where we serve all kinds of patients that are here.
Okay, so Daktari, tell us maybe in terms of the cancer cases that are presented here, which is the one that is leading in terms of occurrence, and also in terms of the treatment that you're providing. How is it now cost effective for these patients?
Cancers, well, normally, in order to say which one is prevailing or leading, we would like to divide it between men and women, whereby in men we see cancer of the prostate is quite high. We see cancer of the esophagus. We have quite a number of patients who have that. Cancer of the lung is also present, especially among the population that are smokers. We are also seeing cancer of the lung. For women, cancer of the cervix and cancer of the breast are quite common. We're also seeing other cancers like leukemias also creeping in both genders. For children, the most common that we're handling here is osteosarcoma. We have quite a number of patients who have cancer of the bone. We also have other children who have other cancers, for example, non-Hodgkin's lymphoma, and even leukemias. So that's quite common among children.
Tell us maybe in terms of the treatment aspect, it's more or less the doctor and also the patient, but how best do you help these people to even survive? Like the latest patient we've spoken with, she's very confident even after having undergone surgery in January that she's still optimistic that she's going to beat this disease. So how best can we address this issue as a country and also here locally in Nakuru in terms of determining when to come to the hospital and also how to be treated?
I think what we need to be really grateful for is the fact that this center was opened. And perhaps if the policymakers would think of having many more centers like this, because the numbers that we're dealing with are quite large, and if we had more centers, then the burden of the patient numbers would go down. We're also very grateful that we have senior consultants like Dr. Gladwell Kiari, who comes here and ensures that patients who have complications or patients are reviewed, and actually the chemotherapy prescriptions are done and are correct, and that has really helped the patient care in Nakuru County. What can be done? I think there needs to be more focus on training. We have very few oncologists in the country, and cancer is becoming a leading disease. We're actually seeing so many patients. So if we had more specialists in that area, that would really help. That would help the patients get optimized care. I think other services that will be considered and are very important that we do not have currently is radiotherapy. Patients who need treatment like radiotherapy now, we still have to refer them to centers that have it. That is perhaps private centers or Kenyatta. There's a government center that has it. It would be very nice if the government would do that. For here in Nakuru, there are plans underway for us to have radiotherapy set up here so that we stop having many referrals to Nairobi for patients who would need radiotherapy. And also awareness. It's very important for patients to really know, and the whole public to know that cancer is there and it's treatable and the treatment is affordable, especially if one has NHIF. And when you do the cost of treatment vis-a-vis the cost of having NHIF, then it's really advantageous to have NHIF. So I would really urge the public to really take up NHIF, and we're very grateful that the hospital management here under the watchful eye of Dr. Mburu has made sure that this is a center that is given priority. It's a center where drugs are available. It's a center where continued care is possible. Yes. So there are challenges that have existed, but they're being addressed in due course.
Okay. Thank you so much, Dr. Wanda. That was Dr. Dalcy Wanda, the one in charge of the Oncology Center here at the Nakuru Level 5 Hospital. We'll be speaking with her still on the sidelines, but Smriti, it is a disease that is diagnosed. About 40,000 people in the country annually are diagnosed with cancer, and almost more than half of that number end up dying. But centers such as these here at the Nakuru Level 5 Hospital are bringing hope to those in the South Rift region who have been diagnosed with this disease, and also helping the capital city. So for anyone within the South Rift region, the Nakuru Level 5 Hospital is also a center where you could get assistance as far as oncology is concerned, and they are encouraging people to really present themselves to hospital immediately they notice something is amiss within their bodies. So we'll be following up this story on the sidelines, Smriti, but it is a curable disease the earlier it is detected. Smriti.
Bridget, thanks very much coming to us live from Nakuru, and a positive outlook there from that particular doctor at the Nakuru Level 5 hospital. And while she did say that, of course, while cancer is a disease, it is treatable, a couple of issues do arise. One is, of course, the cost, which we have touched on, but also access to medication and also the very few number of oncologists and specialists in the country. Sarah, what is your feeling on why we have such few oncologists in the country treating the disease?
Yeah, thanks. I would say that we need to look also in terms of the training. It takes long to train to become an oncologist. There's undergraduate and then postgraduate training, and after the postgraduate training is when one can go and further specialize in oncology. It needs to be prioritized by the government in terms of it supporting those who have interest to go for the training, because the training is generally full-time, and so to go for a full-time training means someone needs to support you financially in terms of a salary. By then, most people already have families, so what do you do for your family, leaving them behind or going with them? So the investments that's required to train one oncologist is a lot, but it's certainly worth it because we have the numbers in the country and we need to improve or increase the treatment centers. Some institutions also have taken up that and may try to train their own oncologists. For example, for myself, my training was supported through Kijabe Hospital. That's because the institution looked at where we are in a rural setting. How can we help deal with this cancer situation? So we developed a low-cost model that tries to work with NHIF so that our patients do not have to pay over and above what NHIF is providing, and at the same time we try and fundraise for them so that we can meet the cost if there's a difference. Right. But in order to provide that service, we need an oncologist. So for me, I was
because one of the key issues that we've had being mentioned is late diagnosis, and sometimes people go with the symptoms that are of cancer, but the clinics where they end, if somebody is in Nakuru, Nyandarua, so stratified way, where we can train, even basic training of understanding what are some of the early signs and symptoms of cancer.
We touched on the issue of a lifestyle change, creating awareness, of course, but what else can be done to prevent cancer? Of course, in some cases it is not preventable, it may be genetic, but what are some of the areas that an individual can look into?
Is that for me? Or
yes, for yourself.
Yeah, I think the key issue here, the key things are actually lifestyle change, and then continuous screening, okay? I think people need to go for screening and then being aware of your body. And this is something that we tell the survivors and also the caregivers. If you feel different, you don't have to be really over aware, but if you feel your body is different. And then one of the things I think people who can help us with this in the grassroots are the cancer survivors. As you've noticed, everywhere where they are doing interviews, they are interviewing cancer survivors who have gone through the process. So we need to empower the cancer survivors so they become advocates in the grassroots. Faraja might not go to Turkana, but I know someone who, if I train in Turkana, they understand their dynamic, they understand their location, and they can tell the people. The other thing is stigma. For example, some of the gynecological cancers, ladies have stigma, for example, cervical cancer. There's a lot of stigma around it. So if we use survivors of cervical cancer and other gynecological cancers to be advocates and training people, when you feel this, when you feel that your periods are irregular, when you spot blood, I think it's important for you to go for further tests because we keep quiet with these symptoms when we see them.
Shienze, as a cancer survivor yourself, do you feel that you have that responsibility to be a role model and a mentor to others and, you know, create awareness by sharing your story?
I said from January that, like, when I finish this treatment, I'm going to really raise awareness on reproductive health, you know, because mine really tackled reproductive health. Just to add on what he has said is that also I think mine was a case of misdiagnosis because I sought the hospital as early as I was 12, you know. So if, another thing I would say is, if doctors, some of the doctors, I think it's pride or something, because for me as a designer, if I don't know something, I'll consult a different person. You'll get results and the doctor is not willing to even ask or ask the other doctor, this looks strange, I have not seen it, or do you think, like the sense of pride, I think should just, because you're dealing with human beings, lower your pride, consult other people if something is beyond you. Then two, I also think in terms of lifestyle, mine was a case of misdiagnosis for so long, so maybe if I did, it was bittersweet. It was also still discovered early. Stage 2A is quite early. But also I think in terms of lifestyle is a big role, because once I realized now Kumas, but before I wouldn't do that.
Taste good,
yeah, they don't taste good.
They can. Different recipes, they can.
Yeah, so I think I would really, because for me, I got cancer when I was 24. Yeah. It's really a young age, just really advocating, even young people can go through the, because for ladies, it starts with your reproductive system, you have irregular menses. For me, for a very long time, it showed that I had cysts, which was not the case, you know. So just going as early as you can, supporting people. Like for me, I would easily go to a supermarket and buy food and take them, because for me, and these cancer things, unless you have gone through it, it's hard for you to understand the magnitude. For me, I've been a caregiver and I've been a patient. So I know how it is on both sides. And also for the caregivers, if the support, like, encourage them. You see, they are taking care of people. The people, for me, I can relate to the pain. But now you're taking care of me, you can just imagine, oh, she's feeling like this. You don't know, you can't be in my shoes as much as any. So I think the caregivers and then doctors to lower their pride, and just, if something you don't know, you just consult. And then also, I've had an issue also with the frustration with NHF. It's good, but also it's horrible. You know, like, you go somewhere, they tell you, unless you're a civil servant, surely, must all of us be civil servants to be catered for some things? That word of civil servants, not all of us can be civil servants. And they should either say, if you're not a civil servant, raise your contribution, and then now you're catered like the rest of the people. Then also approval. You want to do an MRI, the doctor needs it like today or tomorrow. Then they take you to a section, NHIF. So the NHIF has to approve after 2 days. They say 48 working hours. So 48 working hours, let's give it like each day is at 8 hours working. So that is 6 days. You'll get your MRI done after 1 week and something. Yeah, you go there. So it's really not making sense. Because I believe NHIF is a pool where many people contribute. And not everyone is infected with the disease. There are people who are doing, I think they should give priority to the cancer patient. Let's do it. Let them have free, and then also supply of medicine. Of course. Where you think you're going to get the medicine, they don't have. You have to wait, or you have to buy outside the hospital, which is more expensive.
Okay, so clearly a lot of issues do need to be addressed. Virginia, look, on one hand, there is the reality that people do triumph over the disease and survive. But the other reality is, unfortunately, not everybody does survive. But some of their stories are still success stories, because just going through and living with cancer is, you know, a survival story in itself. As a woman who has lost somebody, your mother, to cancer, what are some of the coping mechanisms that you experienced and that you would recommend to other people who are perhaps in the same situation?
All right. I think for a start, I don't think we handled it very well. We've had as a family to deal with it along the way. Being the firstborn, the first reaction for a lot of people, especially the older folk, was be strong. You know, you don't show your siblings to grieve or cry. And I'm a lady. For my father, it was worse. Like, you know, you're a man and an African man. But I remember a lady telling me, who had also lost a mother, not to cancer though, and she told me, if you don't grieve in this process, you will have a very difficult time. And I keep saying grief can be personal, but it's not private. And this is what I mean. You will walk into a supermarket and see a perfume that she liked. Only you know what she meant to you, but the tears will flow. So everyone else around you gets to see that. So one, it's very important to have support, incredibly important to have support. People who will allow you to grieve, if you scream, shout, whatever it is that you do, or cry, to talk about it. I think that's almost a huge part of the healing. You're also allowed to get angry, you know, and I was angry for a really long time. And sometimes I feel for my brothers because I didn't get to see them mourn, or at least I didn't get to see them mourn like I did. That's a bit selfish. And I know in one way or another, it has affected them. And for anyone, I think looking back, the one thing I would do different is push my father to accept help. Because he became at one point the primary caregiver. I mean, to a point where his pressure was so high and he didn't know. Not just my father, any man really get help. This a subscription to You're an African Man, You're Strong, go for counseling, seek therapy, and most importantly, what conversation or preventive measures, just also educate people, especially in the village. You will have quacks who come and tell you, this is a magic pill, swallow it. And because you're so desperate, because you have all sorts of treatments and you don't know, you will take that in, and you don't even know what that pill or that drink or whatever it is you're being offered has. It will be very important to, especially for guys in the village, don't think about the town area. They will do anything because they probably have sold everything they have to get to where they are. Yeah.
Right, some great advice there, thank you. At this point, just before I come back for our closing remarks, I'd just like to cross over to Lois Wangoi. Remember, we heard from her earlier. She's coming to us live from Eldoret in the county of Uasin Gishu. Lois, over to you.
Thanks, Smriti. And from the studio, we are now in the streets of Eldoret. We want to speak to wananchi here and get their views and opinions, or even their understanding on cancer.
Kwa sababu mke wangu alikuwa na ugonjwa wa kansa kuanzia 2002 mpaka 2017. Alikufa mwezi wa 6 2017. Nilitumia pesa mingi. 2002 CT scan hazikuwa zimeingia katika nchi. Lakini aliendelea kugonjeka na akawa mnyonge na akawa anafanya kazi lakini hana nguvu. Mpaka hizo siku tumekaa nayo, nilitumia pesa mingi huku na huku kubahatisha tu.
Shida tuko naye wananchi wa Kenya ni umaskini. Mtu unakuta amegonjeka, anaenda kliniki ndogo ndogo, anatibiwa malaria, anatibiwa nini, kitambo aende hospitali kubwa apimwe na apatikane yako na kansa, unakuta imefika stage ya mwisho. Watu wengi wamepoteza maisha kwa ajili ya umaskini,
na imeaffect watu wengi sana, familia. Na I have a friend mwenye alikuwa na kansa akakuja kugundua in the late stage. Reason being hakuwa ameambiwa how to deal with it, how venye atenda kujieleza. Watu wanaona tu ni ugonjwa na kuja pole pole, na kuunderstand ni ngumu sana. Kabla realize kwa ile stage ile ni critical, na tena expenses za kutibu inakuwa very hard.
Ugonjwa wa kansa kuna matumaini. Wakati unamtumainia Mwenyezi Mungu, inafika mahali anakupa matumaini ya kuendelea kuishi.
Tunaomba serikali waweze kuwasaidia hawa kwa njia ambayo wanaweza kupatia msaada, na waweze kutangaza ya kwamba hii ugonjwa wa kansa iwe ni disaster katika nchi yetu ya Kenya. Wakitangaza kuwa disaster, watu wa serikali watakuwa na ile jukumu ya kuweza kuwasaidia wale watu ambao wanaishi ya ugonjwa wa kansa.
Na mambo ya gharama ambapo kwamba wagonjwa wa kansa kupatikana na kansa
wakienda matibabu wanapata gharama kubwa ambayo kwamba inawashinda kumudu ile gharama. Sasa pia ni tatizo kwao. Pia waweze kuwahurumia na waweke mambo yao iwe sahali, waweze kuwasaidia. Sio lazima mgonjwa kija pale pengine ana pesa uache kumshughulikia. Wazingatie ile matatizo ambayo amekuja naye.
It's a conversation that we could definitely not exhaust at this particular morning, but a majority of those we spoke to, especially those who were shy to appear on camera, did note that prevention remains the best bet in fighting cancer in the country. For now, back to you in Nairobi.
Lois, thanks very much. We're almost out of time, but just my final, or rather my guest's final comments and thoughts on the issue of cancer. Shienze, I'll begin with you, your closing remarks.
I want to urge everyone, whatever capacity you can be able to help a cancer patient, don't ignore that poster. Don't ignore whatever prompting you have to help them. Go, just visit them, check the need, do what you can. Don't limit yourself to only money. You can do other things to them. Right. And it's not a death sentence. We can beat it. Yes.
Certainly, and as you have done.
Yeah.
Thank you. Dr. Muma.
Yes, I would say as a pediatric oncologist that it's people need to remember that children do get cancer. When we say 3,000 children in Kenya will be diagnosed every year with cancer, it could be anyone's child. The difference for children is that there are no lifestyle modifications you can make in order to prevent it from happening. The only thing we can have is early diagnosis. So for anything that seems suspicious, seems odd in a child, please go to hospital so that early diagnosis, if it is cancer, will save that life.
Thank you, Philip.
My final remarks is for those who are going through cancer, it's important to know that you're not alone. Faraja is there to support you. There are organizations like Kenya Network of Cancer Organization that can also support you through treatment and knowing where to get help. Cancer is not a death sentence. Thank you.
Thank you, Philip. Virginia.
I mean, for anyone who is going through, either you're grieving or you've lost a loved one, or you're dealing with the aftermath of someone who has already passed on. One, there is hope. I mean, I'm a testament that you can smile again. Two, get help. And three, rally around that family, if it's a friend or a relative. Thank you.
Thank you all so much for your contribution on NTV Today. Cancer, of course, is a key but sensitive topic. Your input is highly appreciated, and we really do root for all of you in what you're doing in all your various capacities. Thank you. All right, with me in studio, Shienze Kasohashi is a cancer survivor. Beside her, Dr. Sarah Muma, a pediatric oncologist. And beside her, Philip Odio, he is a patient support manager at the Faraja Cancer Support Trust. And beside me, Virginia Wangeshi, who lost her mother 10 years ago to cancer. That's where we leave it on this part of NTV Today. And from this conversation, we shift focus to some entertainment news with Usha. Usha, good morning. Great to see you. What do you have for us?